Hi everyone, Dr. Mac with another video and this exciting news on the start of my new communication Osce course. I've been working on this course from the past 2 years. So many people have requested in the past 3-4 years that please teach communication. We all have been struggling. And with the patterns changing, more and more people are kind of like struggling with communication. However, if you actually look at the science behind it, communication is the basic phenomena, the basic science on how do you talk to your client. And that's what ADC is testing, that you pass tomorrow, there's not going to be any training. You're going to be sitting in the clinic, you're going to be talking to your patients. Someone will have a wobbly tooth, some will have a lot of medical conditions and you need to treat them. Someone will come with a complex scenario with the wisdom tooth extraction, sinus involvement. How are you going to do it? How are you going to manage a child with 4-year-old? How are you going to talk to that old lady? She has missing teeth and want implants with a dozen of medical conditions. And that's what ADC wants you to check and see, that if you can actually sit in the practice tomorrow and deal with these clients, they're not difficult scenarios. They are what you do on a daily basis. And my vision of teaching communication has always been different. I always say communication can't be taught online. The problem is majority of the people are teaching communication these days like they teach part one. The difference in part one is you're not talking to the patient or as an examiner. You just go and do your exam and MCQs and it can actually work well for you. But when you actually sit in front of a live examiner behaving as a patient, your whole body language changes. You start to panic and you start to struggle because you have never practiced that. All you did was a Zoom call, maybe your video was off, you're laying down on your couch and you were learning and getting the information. I've said this in my previous videos. Communication, Osce, you don't need a lot of information. You need basic science. The things that people struggle with is what to say and how to say it. And that's where the biggest problem arrives, because they know all the information. They've taken all the courses with Zoom calls and online, and they sit in front of the examiner and now they're struggling because they've never practiced that. So with my vision, what I want to start my communication training is with a limited number of people. I believe in quality. I don't want to teach 50 people or 30 people together, because that way they won't be able to get the learning. What I've decided is we will take badges of only 6 to 9, not more than that. And then you'll have already all the material, reading material and everything, so you don't have to worry about that because you don't need a lot of that. And then you have a 3 days on-site sessions with me and my team, and I've got some team that has been leaders in the industry. They have been teaching ADC. They have been doing and teaching, have done the exam, so they exactly know how you need help and how it's done. And I'm so proud to say all of them have been my past candidates who have passed the exams. They've done the learning under me. So I exactly know that they understand my vision. They exactly know what to do. So I've got a team of 5 mentors. That's going to be included myself. And what we're going to do is we're going to have badges of 6 to 9 maximum. And on those 3 days, all we're going to do is practice the role play sessions with you. So in those 3 days, you already have the prerequisite materials. You'll practice the 3 days on-site role play sessions on how to say, what to say, how to correct your problems. And all the mentors and myself are going to be guiding you through the 3 days. You'll be practicing, say, about 50 to 100 role play sessions within those 3 days, and even more watching your other participants, and you'll get the recording of all of those and a library of 100 plus videos that we have done with our past candidates, with the course knowledge that we have created. And then we'll have closed WhatsApp groups. We'll be able to review all that knowledge with you until you pass your exam. Because I want to deliver that knowledge with a limited amount of people. If you have 5 mentors and 6 students, or 5 mentors and 9 students, and everyone is getting 1 mentor per 2 students, and you're practicing role plays for all those 3 days, in and out, on how to do every single scenario. We'll change the scenario. And I'm so excited to offer this because this is where everyone has been struggling. I feel communication is a basic science on how do you actually communicate with the exam. How do you talk to a patient? If you're the dentist tomorrow and if you're sitting in your clinic and someone comes with a wobbly tooth, how are you going to manage it? How are you going to manage a child? How are you going to manage someone who's flying in tomorrow or flying out tomorrow and been driving from 3 hours and they're really pissed that they need their tooth to be treated today? How would you treat someone with a big swelling? And for me, graduated in 2012, moved to Australia in 2014, worked with multiple practices with over 40 different dentists when I was working as a practice manager. At the moment, been working over 6 years in Australia working with multiple clinicians, multiple practices, with so much knowledge under my belt now, because I do from general dentistry, the cosmetic dentistry, to implant dentistry, to you just name it. I've done multiple courses from all around the world with the knowledge of what you need. So any scenario comes in, it's not like it's something foreign. I know exactly what to say. And then my whole team's going to be there guiding you through. I've got industry leaders when it comes to those difficult scenarios like hematoma, wisdom tooth extraction, all that. What is the relevant information according to the Australian guidelines? What is required and what do you need to say it? And what we will be doing is we'll be running these courses from all around Australia. So we'll be starting our course in Melbourne on the 26th, 27th, 28th of October. I'm really excited for it. And from there, we'll be going to Sydney. We'll be booking students. I'll be going to Perth. We will be going to Tasmania. We'll be going to New Zealand. We'll be going to Brisbane. So wherever you are in Australia and you have 6 people who need help, minimum 6 people, maximum 9, we won't be increasing the badge that we have planned for now. We want to focus on the quality. We will be coming to your city and we'll be teaching you, but it will be delivered on site. I want to sit down in front with you and I want to do that role play session. And I want to teach you the science on how to effectively communicate, how to control your body language, and exactly what to say. And because you'll be practicing multiple times, you'll exactly see how this science works. How, when the examiner changes the scenario and they act angry, how to calm down and focus on that scenario and work on it well. And I've seen people with technical support getting so much help, and with this communication, I think it's going to be a game changer of how the help could be required. So I'm really excited to start this communication OSCE course for all the people around Australia with that on-site learning experience that has not been taught before, and giving you the science on role play learning, managing, diagnosing, treatment planning, and how to actually do what is required for the exam. So if you're interested, you could always comment with your email address and message directly on my Instagram, Dr. Murtaza Mak, on my Facebook, Dr. Murtaza Mak, or our Facebook page or YouTube channel, and then our team's gonna get back to you. It's gonna be limited spots only. So the moment everything is filled, it's filled. And then we'll have a waiting list that is started. We have over 50 people already been waiting that have been messaging us. They're already a big wait list. But I feel like communication, once you practice the role plays in person, it's gonna make a massive difference to what the science is and why people are struggling. Because there's so many things have been involved with communication, because either it's online, either someone is teaching, hasn't been practicing themselves, or they're very fresh to the dental industry themselves. And these questions actually, some of them even struggle themselves. So it's very difficult for them to give you the right answer of what is required. I always believe every mentor is amazing. They have their knowledge and science behind it. That's why they're teaching. But what you want to do is you want to have the pros and cons and see that where are you getting the maximum benefit? And is it going to be more on site or is it going to be online? And is it role play sessions or not? Because that's where the majority of the difference happens. So looking forward to teach you all the science of communication with my amazing team that I've created and curated, and every single person there. And I can't wait to see you all at the course and see you all around Australia. So DM us your request, and I'll see you all in Melbourne on the 26th, 27th, 28th of October. I'll see you soon in our new communication course, and I'm really excited for it.
Can't stop now, came way too far, won't throw in the towel. It ain't looking real good, but I won't give up. Pac said that I gotta keep my head up, so I ain't going nowhere. Yeah, I'm standing right here. Demons all around, but I ain't got no fear. You can kick me round, but I won't stay down. I run this town, ain't backing down. We going in rounds. Yeah, the winds will blow, but these roots too deep. I'm on my feet, the underdog, and I won't be beat. In the fire now, but I won't be burned. I was waiting for this, and now it's my turn. Sweat on my face, blood in my eyes. Been underground, now I aim for the skies. Don't quit now, you can last longer. All these wounds only making you stronger. Don't give up now, yeah, you gotta climb. But we give it to all until the end of time.